Hello, my name is Paul Clemens, and I'm a nurse in the Interventional Radiology Clinic. And I'm going to talk with you about feeding tubes and what you need to know about them as you get ready to start your treatment. As you may have learned by now, a high percentage of patients undergoing treatment for head and neck cancer end up needing a feeding tube at some point in their treatment. Your oncologist will talk to you about your specific case and your likelihood of either needing or not needing a feeding tube. The most common reasons a patient would need a feeding tube during their course of treatment are pain, which sometimes the pain can be so severe you can't swallow. You can have tumor blocking your ability to swallow, or the muscles that you use in swallowing can become too stiff or too weak to push the food down. And there can be other reasons related to either surgery or other treatments that you're having during that time. Once your oncologist has determined that you need a feeding tube, it's important for us to be able to move quickly to have that feeding tube placed. This will help you first to feel better sooner. It'll help speed up your recovery for when you're done with treatment. It will help you to avoid getting as severe of side effects during treatment, and it may even help you to avoid some of the more severe side effects. Helping you to maintain your nutritional status will give your body what it needs to help you recover and rebuild muscle. This is designed to help you to get the best outcome from your treatment by being able to get as much of the treatment as your doctor recommends. Your oncologist will have one of the interventional radiology physicians evaluate you. And this is important to help determine what type of tube you need and what way that tube should be placed, because depending on your particular case, there will be different things we need to take into consideration. Not all types of tubes are good options for all patients. The screening will help us be certain what we need to have ready for you when the time comes that you need it. We've also found that the more we can prepare you for the care of the tube and knowing what to expect from having the tube, the better your outcome will be. Of the patients who do need a feeding tube during their course of treatment, most will only need it for 3 or 4 months, and then it can be removed. A small percentage of patients may need it for less time. A small percentage of patients may need it for a little bit longer. And there's a small percentage of patients who may have a permanent swallowing problem and will need a tube for the rest of their lives. Your oncologist will talk to you about the specifics of your situation and will be able to cater your care to fit your needs. When you have a feeding tube, if you're wearing a shirt, no one will be able to tell that you have one. Generally, the tube is placed just below your ribs in the middle of your stomach area. Sometimes, depending on your anatomy and other considerations, it may be placed at a little bit different spot in your abdomen. When we see you in clinic, we'll examine you and we'll be able to let you know precisely where your tube will be placed. Our team will be available to work with you throughout your course of treatment and even after you're finished with your treatment to make sure that you have all the care and support you need in using and taking care of your feeding tube. The oncology team dietitian will work with you about any changes in the type of feeding or what liquids go through your tube. The interventional radiology team will see you during your treatment and after your treatment. And when the time comes that you don't need the feeding tube anymore, we're going to help you make that transition as smoothly as possible. If it turns out you need a permanent feeding tube, we'll be available to you throughout the time you have the tube to help you with its care. I look forward to meeting you and working with you to help you get through this with the best possible outcome. Thank you.